Hi, I'm Nailah Thompson from Oakland, California, Kaiser Permanente in the Permanente Medical Group.
All right, Dr. Thompson, can you just tell us your journey? How did you get to this point?
So interestingly, I actually started college as an electrical engineering major. I was a Division I basketball athlete and was very into solving problems. And around the same time, my sister got diagnosed with type 1 diabetes. And just seeing her struggle with being healthy, being hospitalized often. I was really intent on helping people with diabetes live healthy lives and not just have this disease that makes them be a diabetic. And so my sophomore year of college, I actually switched to pre-med. And that's how it all began. I really wanted to help my sister and others who struggle with diabetes have a healthy life. While I was in med school, my sister passed away. And so that really kind of furthered my passion. It was a point that I had to decide, do I give up or do I do this for her? And that was kind of my motivation. And over time, I finished medical school and I went to train in Oakland, California. And what I saw every day training at a county hospital is inequities and health disparities. I saw people from communities of color presenting later in their disease, much sicker, dying earlier, more heart attacks, more dialysis. And I knew that I wanted to do something that focused on these communities, on how we keep people healthy, not wait till they're sick. So I finished my internal medicine training, trained in preventive medicine, did my master in public health at Columbia University, and really wanted a career that allowed me to focus on communities of color and our Black community and how we help them live their healthiest lives.
Wow. You mentioned about preventive medicine.
Yeah.
We're talking about hypertension.
Yeah.
Can you speak about just some, well, one, what are some risk factors that we may not realize are risk factors for hypertension?
Yeah, so I think one important thing to know is that the Black community has hypertension more often. We get it earlier. It's harder to control, and we die more. We have strokes more. We have to be on dialysis more. And I think we have to acknowledge all the things that go into having high blood pressure. Genetics is one piece, which we can't change our genetics, but it's important to know. But we talk about physical activity. We talk about what we're eating, and specifically salt in foods, looking at if we have access to healthy foods in our community. But there's also chronic stress, which can affect our blood pressure, facing discrimination regularly, racism, the stress of living in high cost of living. All of these things can affect our blood pressure. And so when we try and treat people's blood pressure, we have to address all those things.
So where do we go from here? Is it an insurmountable task?
Yeah.
But what can we do?
You know, I think it's really important that people in the Black community first find someone they trust in the healthcare system. There's lots of reason in America for Black people not to trust doctors, not to trust healthcare systems. There's been horrible atrocities in medicine against communities of color. So to start, you have to find someone you trust. Hopefully they will look like you. Sometimes they may not, but someone who listens to you without judgment, allows you to be a part of making those healthcare decisions and listens. Our job as healthcare providers and as physicians is to meet you where you are and learn about what you're facing. Because if I just walk in the room and I'm always focusing on the number and giving you a medicine, I'm missing the point. If you're stressed at work, if you're having problems sleeping, if you're not able to get healthy food, then we're going to have a hard time getting your blood pressure controlled. So my job is to meet you where you are and come up with a plan that helps you wherever you are to control your blood pressure. That may be adjusting the foods you're eating and making them more healthy. It may be giving you resources to make sure you have stable housing. All of those things affect your blood pressure.
So you are an incredible Black female physician. How important is that we achieve that health equity in our community?
I mean, to me, it's everything. And I think, you know, it's important for those coming behind me to see people who look like me, who are doing this work. I was a first physician in my family. I've actually never had a Black physician myself, but my goal when I'm out in the community is to make sure all the youth know they can be a physician, they can be anything they want to be, and then to make sure that we are supporting them through that process so that they graduate high school, so that they get into college, they know how to get into medical school. This is a part of equity, is to have doctors who represent the communities we serve.
So going back to hypertension, once again, you know, are there some things that we are missing out on that we can just do on a daily basis that you see just in your practice that we're missing out on?
So one thing is to really pay attention to what we're eating. I think we often think we're eating healthy, and most of the time, some of us are so busy. I don't always cook all my own meals. When I eat food that someone else cooks, it's going to have more salt. That's going to make my blood pressure higher. Paying attention to what we eat sometimes will make us say, oh my goodness, I didn't realize that this has this much salt. So I encourage people to track, even for 3 days, one time, everything they eat, and look at reading the labels. We really want to try to stay less than 2,000 milligrams of sodium a day. It's really tough. A lot of things have sodium. If you eat any kind of packaged meals, you're going to get a lot of sodium. One thing that people don't think about is if you go out to sushi and use soy sauce, if you're dipping your sushi in that soy sauce, you already have all the sodium you need for the whole day, pretty much in 1 tablespoon. So those, of soy sauce. And then you have to add all the other things. So I think I encourage people to eat as healthy as you can with what you have access to. The more fresh fruits and vegetables is always better, and eat things in its most natural state. So instead of eating fruit snacks, eat a piece of fruit. Instead of eating fruit juice, eat a piece of fruit. Lots of water is really important for our body in general. We drink so many things. We drink juice, we drink soda, we drink coffee, we drink energy drinks. All of these things are not really healthy, so really try to drink mostly water. These are things that most of us can try and focus on.
So does a question came up, does exercise help lower hypertension?
Absolutely. Exercise is good for us in a lot of ways. It lowers our blood pressure. It can lower our blood sugars. It helps with mental health stresses. And you don't have to go from doing nothing to running a marathon. So if you've not been super active, you can start with just walking around the block, and then you try to increase over time. Try to vary what you do. So if you go for a walk, walk a little fast and a little slow, go up a hill, and try to do different things. Try dance, try swimming. But yes, it's really important for blood pressure, but so many things.
Yes. Can you just mention briefly, just maybe a story about somebody that may have had hypertension and then what they did just to give encouragement to some of our viewers?
Yeah, I think, first of all, if you have high blood pressure, you too can live a healthy life. And I think I encourage my patients to think about this as something that they're dealing with and not who they are. And sometimes, unfortunately, some of our community has just been told something like, oh, your blood pressure is just high. And they come in saying, oh, my blood pressure is just high. And that's actually not true. We can always do something to work on your blood pressure. And I think being aware is one thing. Taking those steps that I said to follow what you're eating. You may not realize that, let's say, the bacon or sausage that you eat every day may have a lot of salt. Processed meats, lunch meats, lots of salt. Sometimes we have to eat frozen foods or canned foods. When we do that, we want to look for the lowest variety of salt. So if it says no sodium, that's a better choice, because I understand sometimes that's what we have access to. So trying to make what we are able to eat the healthiest variety, add in those fresh fruits and vegetables, and, think about eating 3 healthy meals a day, drinking lots of water. These are all things that are, I won't say they're easy, but we can do.
Yes.
Another thing to think about is stress and how much that affects our blood pressure. And so I to do meditation, use apps like that are available on our phones that can help us learn to do that if we don't know how to do that. These things help with our blood pressure as well.
Awesome. Okay, last question. You are an incredible, accomplished Black female physician. What would you tell the younger self or some young lady that's watching right now? What would you tell them just to encourage them who are thinking about possibly going into your profession?
Yes, I think I would tell them that they are enough and that they are beautiful just the way they are. I think sometimes as Black girls and as Black women, we feel pressure to look a different way, to not be ourselves. In my life, I've learned to embrace my natural self, which took a long time. I think I would tell them to find people who can mentor them and sponsor them. Again, I didn't know any Black doctors, and I thankfully figured it out. But talk to us, talk to me, because I want to help those coming behind me not to have to figure it out on their own, to give them tips and to save them some of the hoops I had to jump through. So I would tell myself, you're fine just where you are. You have to work hard. we are enough. And I'm not sure that in this country we get that message. I think we worry about a lot, and with good reason, but we have everything it takes, just like anyone else, to make it, to do whatever we want to do.
Well, thank you so much. You heard it here first. Dr. Nailah Thompson, right here live at the NMA 2023 convention. Thank you so much.
Thank you so much.